Doctor on Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Dr. On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management, where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Dr. On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.
Hi everyone, thank you for joining us on today's sessions of Q&A with a specialist. My name is Dr. Raju, and today we will be talking about cervical cancer. It's a topic that we have covered a couple of times here at Dr. On Call, but I can't emphasize enough how important this is. In 2018, almost 500,000 women were diagnosed with cervical cancer, and more than 350,000 of them succumb to their disease. Cervical cancer is something that can be prevented, all right? And in medicine, we always believe prevention is better than cure. So today we have a very special guest with us to talk about cervical cancer and how we can scan for it, treat it, and also continue monitoring patients across time to prevent and reduce the rates of cervical cancer. She is an obstetrician and gynecologist from Sunway Medical Center. She started off a career in Kuching Hospital, all right, and then also served in Melaka GH as well as Kuala Lumpur Hospital, one of the largest maternity hospitals in the country, and before proceeding with her career in Sunway Medical Center. Dr. Ashley, thank you and welcome for our show today. Yes.
Good afternoon, everyone. Thank you, Dr. Raju, for the kind introduction. I'm from Sunway Medical Center Velocity. So in conjunction with the World Cancer Day, so today I would like to speak to you all about cervical cancer and tips of prevention of cervical cancer.
Okay.
All right. So
you have a couple of slides here, Dr. Ashley. Maybe we can begin with that. So, ladies and gentlemen, we will divide our session to two parts today. Dr. Ashley will present some of the material, and we will then follow through with a Q&A session. Okay, so please do type in your questions, and we will try to address all of them. Dr. Ashley, cervical cancer, prevention is better than cure.
Yes. So, did you know that cervical cancer is the third most common cancer? And the rate of cervical cancer actually increases after the age of 30, and it peaks at the age of 65 to 69. This is because actually after the age of 30, most of them are childbearing age range. So therefore, the rates actually increases after the age of 30. So what is actually cervical cancer? It's actually a disease which the cell of the cervix grow out of control. It is also a consequence of long-term or persistent infection of HPV, also known as human papilloma virus. So most of the patients in their early stage of cervical cancer are asymptomatic. That means they have no symptoms. But do aware that if you have certain symptoms such as postmenopausal bleeding, that means you have bleeding after menopause. After menopause, you shouldn't have any bleeding or any blood from the vagina. So if you do have this kind of sign, you should actually consult your gynecologist for a checkup. Or if you have any unusual vaginal discharge, such as continuous or persistent pinky discharge, bloody discharge, brownish discharge, or even foul-smelling discharge, these are unusual vaginal discharge that you have to get yourself checked, because we need to know whether is there any growth or any infections that's ongoing that give you such a signal that is something unhealthy down there. Or if you do have any post-coital bleeding, that means you have bleeding after sex. So if you do have this symptom regularly, you need to get a check at your cervix or vagina to see if there is any abnormal growth that may contribute to the bleeding. Or if you have persistent or long-term pain at the tummy, especially at the lower part of the tummy, do get a check from your gynecologist to see whether is there any growth or anything that's abnormal in the pelvic or the tummy area.
Okay, Dr. Ashley, what about the general symptoms that someone should look out for?
Most of the patients will actually come with complaint of abnormal bleeding, as I mentioned earlier, as they might have out of norm bleeding. Instead of monthly periods, they may have like 2 or 3 times of bleeding in a month, or they may have some bleeding after sex, or they may have post-menopause bleeding where they have bleeding after they have stopped their they have no more periods. That means after a year of no periods, we define as menopause. So if they do have this kind of abnormal bleeding.
And do many of them present with, sudden weight loss, general fatigue, loss of appetite, those kind of things that we see with some of the other cancers?
Because if cervical cancer, they will first present with abnormal bleeding. If like loss of weight, loss of appetite, that will come a bit later at the later stage of the disease. So mainly they will present with discharges or some discomfort, especially during sexual intercourse, or some tummy ache, that is tummy pain that is actually long-term or persistent.
So it's really up to the lady to be aware of herself and not something that a partner or somebody else would be able to see, unlike other cancers, right? And thanks, Dr. Ashley. I would also then ask you, so who would be the women who are at risk for to get cervical cancer?
All right. So they are a group of ladies or women who have higher risk of getting this human papilloma virus infections. These are a list of it. So those women or ladies who have multiple sexual partners, they actually has higher risk of getting HPV infection, because they might get the HPV infection from different partners. So other than that, early sexual intercourse also one of the risk factors. It's one of the cause that might predispose the lady to have higher risk of HPV infection, because when at early age the cervix cells are immature. So this immature cervix actually has higher sensitivity to HPV infection, especially those with persistent HPV infection. As we know that persistent HPV infection actually contributes to cervical cancer in the long run. And those lady or women who use contraceptive pill actually for a long time, especially more than 10 years. So this actually does change the cervix cells sensitivity towards HPV infection. So these changes actually predispose the lady to have higher risk of cervical cancer. Especially the studies actually shows that ladies who took contraceptive pill more than 5 years actually has 10% increased risk of getting HPV infection compared to those who didn't use it. So if you take more than 10 years, you are actually doubling the risk of getting HPV infection and also subsequently risk of cervical cancer. And those ladies who actually have their first delivery at a very young age actually do contribute to higher risk of getting HPV infection and cervical cancer as well. Because as we know that when you're at young age, the cervix is still immature, and then childbearing itself actually has links to the cervix cells changes. And during delivery also, there's also attributes to cervical trauma during the delivery. So in this situation, actually it predisposes these ladies to a higher risk of getting persistent HPV infection and subsequently the risk of cervical cancer. Then we talk about high parity. So we define high parity as having more than 5 pregnancy. So when these ladies they pregnant more times, that means the immune system also the immune response actually get disturbed whenever each time she got pregnant, and that also altered the hormone level in the body in a general way. So at some point, actually, the inner margin of the cervix exposed longer towards HPV infection compared to other ladies. So therefore, also has higher risk of getting cervical cancer. Last but not least, about smoking. We know that smoking actually generally is not good for health, But we do know that smoking actually altered the DNA of these cells of the cervix that actually predispose the ladies to higher risk of HPV infection and cervical cancer in the long run.
So it sounds like there are multiple risk factors, multiple causes, but you mentioned one quite a few times, which is the persistent human papillomavirus infection.
Yes.
So maybe for the benefit of the audience, maybe you could explain a little bit about how virus actually persists in your body for so long. You know, and it's not just like, not all viruses are like, you know, the coronavirus, which everyone is so aware about today.
Yes. Okay, so HPV actually do classify into high risk, possible high risk, and low risk category. So those women or ladies or even men who've been infected with low risk HPV, actually our immune system are able to actually fight against it and eliminate the virus from the body in 1 to 2 years time. So if your body immune system are not strong enough to actually fight against it, and if you are contracted with high risk HPV, which is like HPV 16, 18, 51, 33, so all these high risk HPV will actually persist in the body if you are you have immune system that is not that great. So the persistent high risk infection will sooner or later cause changes in the cells, which will lead to the precancerous cells changes that we categorize as CIN1, 2, or 3, depends on the severity. And in a long run, maybe in 5 years time, 10 years time, or 20 years time, it may become cervical cancer. So this is the uterus, this area is the cervix, and this is the vagina. So this is the area of changes of the cell where if you have persistent high risk HPV infection.
Right. Okay, and so Dr. Ashley, that means that not all viruses last in the body for just 10 to 14 days, or, you know, like with dengue, even like about 10 days and things like that, right? There are viruses that can actually be in your body for many, many, many years and persist there if your body is not strong enough to actually fight against the virus, right? And one of these viruses are the human papillomavirus. Yes?
Yes.
What is this human papillomavirus?
Human papillomavirus is actually one of the virus, actually is the primary cause that the primary virus that causes cervical cancer. Up to 90% of cervical cancer is caused by human papillomavirus, and it can be transmitted sexually. Here we talk about penetrative sex, but do bear in mind that not only penetrative sex can transmit HPV, they can also be transmitted from one person to another person through skin-to-skin genital contact. So if they practice oral sex or anal sex, also they might be contacted with human papillomavirus if the partner is infected.
Okay. And you mentioned this is something that is sexually transmitted, right? So I suppose in a sexual relationship, the partner as well can be infected, and that means even men can carry the HPV virus.
Yes. Yes, you are right. Not only women will get HPV infection, men also can have HPV infection. But most of the men, they don't even know that contracted with HPV infection, because most of them has no symptoms. They don't even realize that they actually have it. So sometimes if the infection's been persistent and then the infection doesn't go away, so you might actually notice some changes at the skin, especially at the private part. You may actually see some genital warts. It will look like something like a small bumpy lesion, and then sometimes it could be painless or painful, it depends. And sometimes it looks like a cauliflower-like lesions. So sometimes it might not even feel any pain, it might not have any bleeding or anything. Some patient might actually experience some itchiness or pain when they have contact with the clothes. So all these changes may happen at the penis, scrotum, anus, or even at the throat or even base of the tongue. So if you notice some of these changes, do not get worried. Get your doctor and consult, see whether is it a warts or not.
Yes, and you all can, of course, book an appointment with Dr. Ashley on Doctor on Call to make to see her either online or in her clinic at Sunway Velocity. Yeah. So, Dr. Ashley, does the human papilloma virus only cause cervical cancer? Does it cause anything else? What else can it lead up to?
Yeah, it's a very good question. It doesn't lead up to only cervical cancer. In women, it can actually cause vaginal cancer. It can also cause vulvar cancer, which is all focused at the private part. And in men, it can cause penile cancer. And not forgetting, actually, it can also affect the throat and the anus part in both men and women. This diagram actually shows us the percentage distribution about each cancer type.
Okay. And I know that with all, with many diseases, testing early, getting yourself vaccinated for in the case of HPV, and regular screening, regular follow-ups to your doctor really helps reduce the rates of cancer. How else do we prevent it?
All right, HPV infection. If you are infected with HPV infection, there's no absolute treatment. So it's better for us to prevent it before we get it. So most important thing is actually healthy lifestyle. If you are a smoker, do stop smoking to prevent any damage, further damages of the DNA of the cells, and then exercise and a healthy diet, and of course safe sex. Use condom if possible. Condom may not fully actually prevent you from getting HPV. Like some other areas, like skin that are not covered with condom may also spread like genital warts, herpes. But the good thing of condoms is it actually helps to spread other sexually transmitted disease like gonorrhea, chlamydia, and HIV as well. And we do suggest for monogamy partners, because when we know that if you have multiple partners, then you increase your chance of having HPV from different partners. And then we do suggest you to have a regular routine pap smear test. So actually Malaysian MOH actually do suggest that if you get tested for pap smear from the age of 25 till the age of 65, if you're sexually active. And if you have 2 consequent yearly pap smear is normal, then you can do a 3-yearly pap smear test after that. And if condition is allowed, then probably we will suggest you to add on a HPV test on top of your pap smear screening. So,
right.
Of course, if you are not vaccinated, we are encouraging you to get your HPV vaccine.
Right. Can you get your HPV vaccine even if you're not tested, right?
Yes. But we'll prefer you to have a baseline to see whether is there any changes on the cervical cell that we would want to either just give you a vaccine, or whether we want to do further tests on you to see any further changes on the cell.
Right. And so, Dr. Ashley, what types of screenings do we have currently available, publicly in government hospitals or even in private hospitals? If you could just name the top 3 that patients should go and do.
All right. So screening, nowadays we do liquid-based pap smear screening, where we actually put you in kind of this position. Then your gynecologist will actually put in a speculum to see your cervix, the neck of the womb, and from there they actually take a small samples from the surface of the cervix, and we send it to the lab to see whether is there any abnormal changes in the cell, and we call it as pap smear. So if you want to get your HPV tested at the same time, you just need to tell your gynecologist, and we'll just add on in the form. So the HPV testing actually is in the same sample that we get from your pap smear, but we at the same time we want to look for the DNA of the virus. So if it's present, then in your report, it will return there what kind of HPV that you have, like high risk, what type of high risk HPV you have, or low risk, what type of HPV virus you have. And we also, in the market, actually, we do have this self-sampling HPV test that is just a brush that you actually just take it from the vagina, that you don't need to see your doctor, you just take it from the vagina, and it's easy, and they come with the forms, and you fill out the form, and you just send it to the laboratory, and they will send you the result. So these are some of the more modern and easy kits that you can get outside.
Okay, Dr. Ashley, I remember in the past, right, it used to be that a woman had to come into the clinic, and it's quite an uncomfortable experience, I think, for anybody who has to come to a public area and get undressed and sit in the lithotomy position in that chair and all this kind of things. And I also believe that was probably one of the main reasons why many women refused to get tested, or did not come up forward. How has these home testing kits changed things?
All right. These testing kits actually do help in those patients, especially they are in rural area. They can't really access the hospital, that they have difficulty to access hospital, where they can't really get a very easy chance to actually meet a doctor. So actually this kit will be useful for those ladies who can do it themselves, and they understand the steps, the easy steps how to do it. And the most important thing is we should actually have a group of doctors that actually look into the results, because if the result come back to be something abnormal, then further investigation or procedure needs to be done. So these ladies actually, they need to be well educated where they should seek for consultation and where they should go to if the result come back to be something abnormal or out of expectation.
Okay, and if they were detected positive for this human papilloma virus, okay, is it something that they can get vaccinated for easily?
All right, vaccine is not the medication, or it's not the cure for HPV infection. HPV infection actually has no absolute treatment. So like I say, if let's say the ladies has been infected with low risk HPV human papilloma virus, then normally your body will get rid of the virus in 1 to 2 years time. So a regular testing, a regular pap smear need to be regular pap smear needs to be followed up, just to make sure that there's no worsening in the cell changes and there is no additional other high risk HPV infection. So if the ladies has contracted high risk HPV infection, then we should know whether what is the next step that we are going to. If the next step should be, we rather want to see whether we proceed for another procedure called colposcopy, where we actually look into the cell of the cervix in more detail under camera. And if there is any changes at the surface of the cervix, then we would like to take some sample from the cervix to be tested in the lab to see whether is there any precancerous stage happening. Because then we will know what is the possible outcome that we might expect and what is the possible implication that it can be.
So in that case, what is this HPV vaccine?
All right. HPV vaccine is actually, it helps to protect you against certain types of HPV related cancer. Now in the market, we actually have 3 types. We have the 9-valent HPV vaccine. What does it mean by 9-valent? That means this HPV vaccine, it covers 9 types of high-risk HPV. Like for example, the 9-valence, it covers the HPV 16, 18, 31, 33, and so on and so forth. For quadrivalent HPV vaccine, it covers 4 types. For bivalent, it covers 2 types. So most importantly is all these 3 types of vaccine, it actually protects against the high-risk HPV types, which is the 16 and 18, that actually cause up to 80 to 90% of cervical cancer. So HPV vaccine, even though you are contracted with HPV, so you will ask me whether shall I get a vaccination? Probably, for example, if you get HPV vaccine, if you get HPV type 16, so should I go forward to get a vaccination? So the answer is yes, but you may not be covered for the type 16 anymore because you're already exposed to it. But this vaccine do help to cover other types like type 18, type 31, type 33, so on and so forth. So it helps to protect you against other types of non-exposed HPV.
Right. And Dr. Ashley, we already have a number of questions rolling in.
Okay.
I'd just like to maybe finish your slides because we have a very interested audience in what you have to say today. So who is the ones who should actually get the HPV vaccine?
All right. We do suggest that females and males, boys and girls from age of 9 to 45 to get prevention of HPV by vaccination. But bear in mind, getting vaccination doesn't mean that it actually exempted you or eliminate the necessity for screening for cervical cancer, vulvar cancer, vaginal cancer, or any oropharyngeal cancer as recommended by your healthcare provider. That means if you are high risk of getting all this cancer, if you need screening, vaccination is not a way to get you exempted. And it also does not cover those types of HPV that is not in the vaccine. And HPV types also will not cover a person who has actually previously exposed through sexual activity. That means like what I mentioned earlier, if you already contracted with type 16, that means the vaccine would not cover for type 16. It will cover other type of HPV.
Okay. Are there anybody who should not get the vaccine?
Definitely, if you are pregnant, so you are not advised to get HPV vaccine. What happens if you already get your first dose, second dose, and suddenly you found out that, oops, I'm pregnant. So what should I do? So don't worry, deliver your baby and then you'll get back the third dose of vaccine after the delivery. If you have any allergies, do consult your doctors before vaccination. And whether breastfeeding, is it okay for me to get HPV vaccination? Yes, you can get your HPV vaccination during breastfeeding.
Okay. Dr. Ashley, I already have a list of questions here, and maybe we can address a few just before we finish your slides. So now there's Zilla who asked a question, right? Does genetics also affect us in getting the disease?
Okay, as if you talk about cervical cancer itself, genetic-wise, we can't comment that actually if my mother has cervical cancer, will I have a higher risk of getting it? Actually, as we know that up to 90% of cervical cancer is mainly from the HPV infection. Yes, there is small percentage of it is not related to HPV infection. It could be other causes, but most of it is because of human papilloma virus infection. So if you say things like ovarian cancer, endometrial cancer, like the cancer of the uterus, cancer of the breast, cancer of the ovaries, they might be genetically related. But as for cervical cancer itself, is up to 90% is because of infection, HPV.
Okay, and I think this is getting pretty hot here, Dr. Ashley. There's so many questions coming in, and I just want to maybe take some time here to ask the audience if you think that there are any of your friends, your sisters, your mother, your aunts who would benefit from hearing from Dr. Ashley today. Please go ahead and share the link. Okay, we're on Facebook Live. Yeah, do get everyone on the show. I think it's very important for ladies to hear what's going on. How do we prevent this? And not just the ladies, yeah, men and husbands, please listen in too. Okay, Dr. Ashley, next question. How often do we need to do a pap smear?
All right. Our Malaysia Ministry of Health actually do recommend that if you are sexually active from the age of 25 to 65, we are actually recommend you to do a pap smear. And if let's say your first yearly, 2 yearly, that means the first year of pap smear is normal, and the following 1 year pap smear is also normal, then you can get a 3 yearly pap smear done. That means you must have at least a 2 normal pap smear yearly. Then you can proceed for 3 yearly.
Okay.
This is just a pap smear without HPV test.
Okay, and the next question we have is from Muhammad Hafiz. Muhammad Hafiz is asking, Doc, jika kita perokok, wifi boleh kena cancer ke?
Alright, if you smoke in front of your wife, indirectly your wife also gets some tobacco byproducts from the cigarette. So this will indirectly cause her to be, the secondhand smoker. So therefore, it does affect her to indirectly cause some changes in the cells in the long run. So generally, smoking is not good for health. So yes, indirectly.
And the next one we have is actually from Fiza. Okay, her question is, sekiranya pesakit sudah membuat pembedahan, adakah kemungkinan dia akan kena balik kanser tersebut ataupun bebas dari kanser? What's the likelihood of cancer to recur after surgery?
Okay, first of all, we would like to know what kind of surgery is that. Is that just a local surgery that they just remove part of the cervix, or they remove the whole cervix with the uterus, or what is the stage of the cancer before the surgery? Whether is it an early stage, or is it something that more than that?
Okay. The next one is quite an interesting one. It involves, our family and our genetics. Is from Ziana. Ziana asks if ibu dia ada cancer, adakah risiko dia pun lebih tinggi? But I would like to extend that question and also try to understand, what if my grandmother had cancer? My sister's second cousin had cancer. How do these things affect our risk?
All right, do have studies that says that actually every one of us do have some elements of like cancer, prone cancer cells in our body. So whether is being activated, or whether is being inactivated or not, it all also depends on our lifestyle. It all depends on our diet. It also depends on how much we take in, and you mean like if you are living a healthy lifestyle, like you exercise, like you have antioxidants, like you don't smoke, you don't take alcohol, and that actually makes your body stronger and your immunity actually better. Therefore, it doesn't activate the so-called the cancer-prone cell that fast compared to those who have unhealthy lifestyle.
Okay, great. The next one, we actually have an interesting one from Norman. Is asking about the human papilloma virus itself. So his question is, Dr. Ashley, I've read that skin warts on the foot are caused by HPV. Is this the same virus? And is this the same virus that I think is related to the foot warts? And what are the risk factors for people who had foot warts? Now, just a message to Mr. Norman. If you're having such a problem, you can actually do consult with some of our dermatologists on Doctor on Call. And yeah, you can probably get a video consultation with a doctor online to have a look at your foot. Yeah, but yeah, Dr. Ashley, back to his question, right? The warts on the foot, can they also be caused by human papillomavirus?
Okay, this is a very good question. To be honest, I'm not very sure about the foot warts, but HPV infection in men, unfortunately, at this point of time, we do not have any tests that can be done. Unlike the women that we can take pap smear and we can test for the DNA HPV. But unfortunately, in men, we can't really test the HPV in men. As I also say that most of the men are asymptomatic. So if they have some skin changes, warts or things like that, it's mainly caused by HPV 6 or 11, especially at genital area. But at the foot area, we do have to know that it can be caused by other viruses as well, not necessarily human papillomavirus.
Okay, and maybe just to direct Mr. Norman, what kind of specialist would you refer him to for some problem like this, for someone who had a problem like this?
Probably he can actually see a dermatologist to get a consultation to see whether is it any other skin related diseases, whether contributes to the warts.
Okay. Thanks, Dr. Ashley. So the next one is actually from Didi. Since men are also susceptible from HPV infection, should men also take the HPV vaccination? I think, Dr. Ashley, you mentioned that, yes, men can also take the HPV vaccination. Maybe you can run through that schedule.
Sure. So, yes. Men is also encouraged to take vaccination because, as we know, that men also can be infected if they are sexually active. So we actually encourage you to start taking vaccine before even sexually active, as early as 9 years old up to 45 years old. So why we put a cutoff point at 45 years old? Actually, 45 years old is actually been licensed by the US FDA. They say that after 45 years old, the vaccination has less benefit compared to the younger population. So yes, men are encouraged to take vaccination as well. So do encourage your husband, your brothers, your son to take vaccination if possible.
Okay. And thank you. So yes, Didi, the answer is yes. Men should also be vaccinated for HPV, yeah? Now, the next question, Dr. Ashley, is from Mr. Xiao. Okay. For women aged above 45, is the vaccine still advisable for them? Maybe she also wants to know whether is it as effective?
All right. So as I mentioned earlier, because HPV vaccine actually been introduced to the world and the market in 2006, so it's been in the market for more than a decade. So when they first introduced, they suggest up to age 26. And for those who are not who are sexually active, they are actually not encouraged us to give it. But in 2016, actually they do revise it. They say that we can give it to those patients up to age 45, even though they are sexually active. They do contribute to prevention. Above 45, their study says that actually the benefit for prevention for HPV actually is lesser, and the benefit is less than 1% of prevention. So therefore they're actually weighing with the cost effectiveness. They don't think so that after 45 years old is very beneficial. So
okay,
if you see changes in the pap smear after age 45, so you need to get a gynecologist to have a look at it to make sure that there's no other changes at the cervix and further procedures that need to be done.
Right. And with 10 years of the vaccine being on the market, I'm sure by now there are already a few varieties. Are there a better version or a more effective version of this vaccine?
The best that we have now is the 9-valent vaccine. So because it covers 9 types of HPV, because when we started with bivalent, which have only 2, so which is our government actually is doing a very good job that they actually provide these HPV vaccines to all the teenagers. And I believe that it's still continue on it. And now the best vaccine is actually the 9-valent vaccine.
All right, so they can get vaccinated, and maybe you could give us a rough idea what would the cost be like to get this 9-valent vaccine?
All right, I think now in the hospital, in different hospital setting, they do have this kind of packages of 3 doses of vaccine. Yeah, you need to take actually 3 doses of vaccine after age 15. That means you'll normally get the first dose now, and then the next dose 1 month after that, and the third dose 6 months after the first dose. So you need to get 3 doses to get it more effective on prevention of HPV infection. And I think different hospitals, they do have different packages and different promotion to encourage more women and men to step forward for vaccination. So
right.
Velocity Hospital, we do also have package for our vaccination. Do check it out in our website to know more about it.
Thank you, Dr. Ashley. So you can visit Dr. Ashley's profile on www.doctoroncall.com.my, and I think through there you can make an appointment with Dr. Ashley and also have access to these packages at Sunway Velocity. Yeah. We have a question here regarding a product that we actually have on our website. Recently, we've actually started selling the Evelyn brush. I think I saw it on one of your slides, Dr. Ashley. So the question is, how good is it compared to a pap smear?
Okay, to be honest, I didn't purposely promote this brush or things like that. And to my own experience, I haven't experienced this brush before. But I know that in the market, there are a few different brands of these self-testing kits that they actually provide a HPV testing that you can do it yourself at home. So probably I will advise him to take a look at the brush, what do you call that, online and things like that. So then you'll get more into it.
Right. And now I have another question about vaccinations here. Should you get tested before you come in for a vaccination?
All right. Get tested for HPV or get tested for a pap smear?
Well, I guess both.
I guess HPV, right? Both. All right. Okay. If you already have a HPV tested, it will be great. Then at least we know the baseline of it. So if you know that, okay, you are so unlucky and you actually get infected with most of the HPV virus, HPV. So then to proceed or not for vaccination is another question, because we know that if you are already infected with most of the type of HPV, then the vaccine may not help much. So whatever that we can do from that is a regular follow-up with your pap smear, and also maybe we need additional tests like I said, colposcopy, to see any more detailed changes at the cell, and probably a biopsy may be needed.
So HPV test will just tell you about the virus, but pap smear would give you more details about the cellular structure and how things are changing, and if probably even a staging of what cancer it is if they were diagnosed as cancer, right?
Yeah, so we can see whether because the cell changes give us an idea how do we proceed next. So if the changes is very significant, so we know that the next step is whether a biopsy is needed or not.
Right. The next question we have here is from Mr. Ng. What if one is vaccinated with the 4-valent vaccine, you mentioned there are a few types earlier, right? If someone's already been vaccinated with the 4-valent vaccine, then should the person get vaccinated again with the 9-valent one? If so, how soon?
Okay, so if you are vaccinated with 4-valent, so if financially you are affordable, so you would want to go for 9-valent, yes, we are encourage you to do that. But at least the intervals of the 4-valent and 9-valent, we actually has intervals of 1 to 2 years time. So we actually don't want you to immediately vaccinated with 4-valent, then after that 9-valent, because we know that there are some overlapping. So the benefit on 9-valent is cover 5 extra types of HPV.
Right. Okay, thanks, Dr. Ashley. So the next question is actually from Miss Amy, and she's actually asking about what are the rates of recovery after surgery. Now, before we go into the question, I just wanted to explain a little bit how obstetrician and gynecologist is a bit unique. Most doctors would either go into medicine or they would go into surgery. Either you see them in a clinic or they would operate on you. But the obstetrician and the gynecologist is actually, I think, probably the only specialty in medicine where both medicine and surgery combine. So Dr. Ashley is one of those people who would not just see you at the clinic and treat you over a period of time, but would also operate on you in an operating theatre and help you recover from such diseases. Yeah. So, Dr. Ashley, what are the recovery rates like post-surgery?
All right, it does depends on what stage of, if let's say you were diagnosed with cervical cancer, we would like to know whether what stage is it and whether is it operable or not in the first place, whether do we need any additional treatment after that, such as chemotherapy or radiotherapy after the surgery. So it all depends on the post-surgery diagnosis, whether how far does it spread and what is the stages, and from there the gynaecologist will actually go more detailed about the further treatment and all. So prognosis depends on the stages of the disease and whether it is operable or not. The subsequent treatment is also important, like the chemotherapy, like radiotherapy, and so on and so forth. So the prognosis and the recurrence actually does depends on different individuals and the stages of the disease.
Okay, so Dr. Ashley, looks like we've run out of time for any more questions. They're still coming in, and thank you for your fantastic answers. So today we learned that cervical cancer continues to affect many women. It's mainly caused by HPV, and it's something that you can get tested for. There are various types of tests, pap smears, and home testing kits. And not only women are affected by HPV, ladies and gentlemen, but also men. Okay, men too can get vaccinated, and vaccination is not a cure. Vaccination merely helps protect you from the disease, and that doesn't keep you away from visiting Dr. Ashley at the clinic regularly for follow-ups, or whoever your doctor is, to make sure that the disease doesn't progress further. Okay, and Dr. Ashley, I would like to thank you so much. Okay, and also to remind the audience that Dr. Ashley is available for bookings on droncall.com.my. Okay, you can book her for a in-clinic appointment at Sunway Velocity. Just go through our website, and she will be able to see you at her clinic. Yeah, right. And on that note, thank you everyone for joining us today. I hope you enjoyed our Q&A with the specialist session, and our final round of thanks to Dr. Ashley. Thank you so much for spending your time with us, taking your time away from your busy clinic to explain to us about cervical cancer today. Prevention is better than cure. Thank you very much, everyone. Have a good day.
Thank you. Thank you. Have a good day.